In our last video, we discussed COVID and how medical has changed. In this video, we'll discuss COVID and home birth, another option that people are looking into to avoid going to the hospital. I feel like a lot of people were leaning for the home birth because we had a lot of people scared to go to the hospital. We're scared to give this to our family. We're thinking it's safer to just have a midwife come in, maybe a midwife and a doula, maybe a midwife and a couple assistants. These people that we think are like our friends or whatever, and they're in our home. So our home is safe. It's our safe area. It's our safe germs, whatever. But unfortunately, I think a lot of people jumped on that wagon this year of the fear really got us, which is understandable, and made decisions that not realizing that as much as the hospital seems scary, it's actually much safer and cleaner. And especially you're inviting someone into your home that could be spreading it all over your freaking house. Are they even wearing a mask? Did they wear gloves? Because I can tell you my own personal experience, my midwife pulled gloves out of her purse. She didn't have them in a bag. She didn't have them in a little box or whatever. She literally pulled gloves out of her purse. So tell me how clean and how good it is to have a midwife come over to your house to have a home birth, because you're thinking you're doing the right thing, being safe, because you're at your home and there's not very many people, maybe your friends and family, maybe your close people around you, and you're like, oh, hospital staff is scary because I don't know these people. But are they scary when you think about they're all scrubbing up and they're all wearing all this stuff to keep them completely like clean for you and your babies? So that's one of the big things that I noticed. This is why I wanted to do this topic, was I feel like a lot of people were cashing in this year. People came out of retirement this year. There's big names of whatever I've seen all over online, people persuading other women to join in and be in part of the natural world because it's not safe to be in the hospitals. It's safer to be at home. But the reality is, what is really safer? There's the risk of there's the home birth. But what if you had your baby at home, you're endangering with that risk, but you also now just invited COVID in your house because she's popping in at different houses, going to different places, and you have no idea. They're not doing testing because if any of us know, our midwives probably did not do testing. Did any of your midwives do any testing? Maybe glucose or any type of testing whatsoever? We know they're not getting a COVID test before they come to your house so many days before and staying like quarantine waiting for your birth. We know that's not happening. We know that they're going off living their life, seeing their friends, and a lot of them don't even think this is real, don't take it serious, don't want to wear a mask, they probably don't want to wash their hands. I don't know, but just something that it's something that I've been thinking about. So I really want to hear what you guys think about this, because it's a very upsetting topic to see somebody use a pandemic to make a lot of money without telling people the truth and being honest of, are you even getting a test to go to somebody's house? Like, who are you being around, and are you clean? Like, we don't know that. So I feel like this is why I really want to bring this topic up, is because I'm just seeing it too much, and it really bothers me of the misinformation. So I want to get you guys' opinion on this because it drives me crazy. So
I think it's important to consider too, even outside of COVID risks. I think it's important to consider that if you have an obstetric emergency that would require you to transfer, that hospitals are less equipped, even more so than normal, to really receive an unexpected transfer because they're so short staffed, or so their resources are so tight amongst dealing with COVID and all the additional precautions and all of the things they have to do. So what risk you're giving to the hospital as well, to have to accept an unexpected transfer, and then really the risk you're putting yourself at if you have to transfer, because already transfers are not a good situation, but more so now during this COVID time. I think that's just something that's important for parents to be, who are considering home birth because of COVID, to think that a lot of times there's this talking yourself into the fact that maybe I'm 5 minutes from the hospital, which I know everyone on this call knows differently than that, and knows that that's actually a fallacy, and that doesn't actually work out that way. However, to somebody who hasn't experienced that, who doesn't know differently, might consider that a reasonable risk or a reasonable option. And now it's even less so because of COVID, I would say.
Well, it's two things I thought of. One is the fact that a birth tends to be considered an exceptional event, and as a result, a lot of people who may have been careful in the way they've lived their life before may suddenly decide that having 5 other people in their house is no big deal. And that's a problem because births take forever, and to have someone in your house for 5 to however many hours is quite a risk. And then the other one is to talk about how prepared hospitals are. I've been slacking on my blood donations this year, and they're desperate. They're desperate for blood. And I have CMV negative, so I'm good for the little babies. But yeah, hospitals are really not equipped to deal with dire emergencies right now. And I would hate for anyone to get inadequate care, but it might be a fact of life at this point.
Also, we know like doctors' offices and the hospitals, they all have protocols, and they may have changed a little bit from the beginning of the pandemic to now, but they do have those protocols in order to try their best to protect their patients, their staff, themselves, everybody around them. I don't know that the same can be said for these home birth midwives, their doulas, their assistants. They don't have any protocols for a lot of things. And that's one thing to take into consideration for those considering a home birth because of the risk at the hospital. But what are the risks are you taking with them not having any protocols? So it's a question I would ask, considering if anybody was considering a home birth as well.
I notice there's a lot of local doulas who are trying to change the policies that the hospital has set up to keep people safe. So a bunch of doulas are thinking that if they're just loud enough and they get on the news, that it will change the policies the hospital has set up. I noticed a lot of them are posting on their page cuddling these newborn babies. They're not wearing masks. I don't know where these people have been, but they're like, oh, look at me, I got to go to the hospital, or oh, look, there was a home birth and everyone's safe, everyone's good. It's so much better than being in the hospital. But you don't know that. And you can't just shout that something is safe to make it safe.
I would circle back to what I kind of touched on a high level earlier, but one argument people tend to make in the natural birth community and home birth midwives and doulas often talk about how there's such big money in obstetrics and interventions and cesareans and all of those things. But when you peel it back, there's actually the whole industry around the natural birth community. And now, so more than ever, I think that they're capitalizing on this event like we were discussing. And because of these hospital restrictions, doulas are losing out on a lot of business that they would have in a hospital birth that they'd be attending. So they're not allowed in if someone has to pick just one person and they pick their spouse or maybe their sister or something like that, and they're not picking their doula, that doula is in fact losing out on income that they were anticipating. So they're highly incentivized to do as you guys were saying, try to get the hospitals to bend their rules, or really just encouraging people to do home births where they can attend. So I would consider those motives as well. And if they're really thinking of you as their best interest or in your best interest, or are they just thinking of their interests?
Well, I guess we already kind of know, but because of the cashing in, we already know that a few of them have been coming back. I've heard of some of them coming back, and they're charging let's call it hazard pay. So already it's quite expensive to have a home birth. In case anybody is wondering, it's not cheap. And actually, you can have a hospital birth for cheaper, even if you paid cash and do not have insurance, because they actually make deals to people that are cash paying people and don't have insurance. And there's other things. You have other options to get to get help to pay for your hospital, pay for your birth. But they don't tell you that. They tell you that it's cheaper. They tell you that a doctor is going to cost you more. Oh, by the way, if you get drugs, it's going to cost more. If you get a C-section, it's going to cost more. All these things tack up, so the doctor makes all this money. But it's not true. I've had a home birth. I've had a C-section. I've had these different types of births, and I can tell you that it was actually cheaper for me to have a doctor do a C-section than it was to have a home birth. The home birth midwife actually charged me more money cash up front before my birth that ended up being transferred, and I never got any of it back. And they literally did nothing. So now I'm hearing the amount of thousands of dollars that I paid. Some midwives are coming back that they've retired or they haven't been working for 10 years or so. They've come back and now they're charging thousands of dollars more than what their fee was before, because they're trying to basically make it like this is a dangerous situation and we have to play it like whatever with protocols. But they don't have protocols. They don't have anyone over them watching them. They don't have anyone making sure that they're being safe. They don't have anyone making sure that they're even washing their hands. Like, they literally have nobody there because it's just them as an independent person making money. And I think a lot of people don't know that we might think it's safe to have this one person come in or these few people come in. But normally with the home birth, they're in there for hours, sometimes days into your house, and of you birthing. And I'm sorry, but it's just not safe. And then to think about the cost of the money and think about all that stuff, I think it's safer for you to go into a hospital, even though we have this COVID going around. Go into the hospital, do your testing, go get tested for it, do whatever you got to do. It's still going to be safer than having somebody come to your house. And then you also have to think about, what if you transfer? What if something happens? They tend to not pay attention to what's going on because, again, they don't have anyone over them, so they don't have to pay attention. So I just think cost-wise, it's not worth it. Risk-wise, it's not worth it. And they're really spinning a different narrative and a different agenda right now to push, because they're using our fears of, we don't want to go to the hospital ever, even when it's an emergency, let alone a special moment of having a baby. So that's something big time I think is going on right now. And it's a lot of money. Like, we know it's not cheap, but I mean, they're charging way too much right now and making a lot of money for nothing. You might as well have your baby by yourself at this point, but that's not safe. Don't do that. But you know what I mean? But it's too much. It's just way too much.
Well, I'm thinking about, like, your midwife would be coming in to your house with her assistants or a second midwife, or maybe it's just her, but she's in there potentially exposing your whole family. But then if something, God forbid, goes wrong, which we all have had this happen. I remember, when we called 911, and there was like 5 paramedics in my living room trying to resuscitate my baby. And then we both got carted off to 2 different hospitals, and then you're like showing up in ER. You're not just, with this birth, it's like, I go right to labor and delivery, go straight in. I don't have contact with anyone until I've got contact with my nurse, who then stayed with me the whole labor. That's not going to happen if you show up there on an emergency transfer. You're going to be bounced from hand to hand, person to person, after riding in an ambulance, which could have carried a COVID patient before you. And it's like, if and when something goes wrong, you just quadrupled your risk from just you're in the hospital, but it's in a much worse situation in the hospital. Plus, you also introduced all these people into your home, and of course, all the reasons why it's unsafe that could have brought that to happen. But as far as COVID risk goes, that's you just upped your ante. If anything goes wrong, any kind of transfer you have to do, it's not going to be smooth. It's never smooth to transfer from home birth, but with the COVID, I can't imagine how hard it would be. It's so difficult. Just, my husband had a pancreatitis attack, and it's like going to the emergency room for that. It's like, where do we go? Like, which one should we go to? Which one's the COVID center? Because we don't want to go to that one. We need to go, it's like, you can't make I wouldn't want to make those type of decisions in labor. Like, oh God, which hospital should we go to? oh wait, they're not taking, you can't go to certain entrances, like, like you might show up at one entrance, like, oh, they don't see you there, no, you can't come in there. um it's just a
And
whole
they
different
totally,
ballgame.
and the birth attendant has totally not thought that through. I guarantee they haven't thought that through at all.
Liz, so can we go over a little bit, if you're comfortable with it, how your transfer took place? Because I think there's misconceptions when you're transferred, like it's a very smooth process. You'll be, if you have to go via ambulance, you're taken up to labor and delivery. And maybe even that was what I was thinking happened. I did not realize, in such emergency too, you were put in the ER. Yeah.
So I didn't go to the ER, but if I had driven myself there, if we had driven ourselves there, we would have had to go through ER. We could not have gone straight to labor and delivery because I was not registered there. Because I came in an ambulance, I did go straight to labor and delivery, but my daughter went to ER at the children's hospital. So she went to one hospital, I went to another hospital. And I wasn't able to see her until she had been dead for 3 days, because they could not, once she died at the hospital, was pronounced dead at the hospital, they could not release her to me or let me see her. She had to go to the funeral home before I was able to see her. And the medical examiner had to take her first and do an exam and stuff. So definitely didn't expect that. I thought it would be, some kind of smooth transfer, but it was not. There was paramedics trying to revive her, then 2 ambulances. They took me in one, her in another. And then also the transfer, you would think that like they would want your midwife's records, or that I would have thought my midwife would have come and told them what was going on, but she did not come. She stayed to clean up and to talk to the police. And so she could not go with me. And they didn't care at all about her records. They didn't ask me anything. They assumed that I had an abruption, like because of the blood clots that I was passing, but I was so out of it because I lost so much blood. They never asked me or took her records to know that I had a fever, because had they known that I had choreo, then I would have been treated with antibiotics, because you get treated with them after the birth. But I wasn't. And because I wasn't treated with the antibiotics, which remember is because they didn't care a lick for her records, and they didn't ask me. They just assumed it was only what the paramedics told them. That's all they looked at. I got pregnant shortly after her birth, and I ended up with a choreo infection in my uterus when I was pregnant, that the doctor felt like was from the last birth that had been held in check by my immune system. But when I got sick, I got a virus, and I just got progressively worse because the bacteria started to grow. And she said it was because it was still in your body because it was never treated. And so I got 7 days of antibiotics after my the next baby was born at 31 weeks because of my choreo infection. So it was like there was resounding effects from the fact that the transfer was not smooth, and they didn't consider her a medical professional. She didn't do this, that, and the other, and they didn't even care to look at any of her records or ask, or, a thing as simple as it was their fever, it's like that just got skipped over and missed, and it caused resounding effects. It caused me to end up with a 31-week preemie. It's like, who would have thought that would affect that much, but it can.
Sorry, I had to take a moment.
On the topic of coming out of retirement after being idle in your profession for 10 years, the only way I would want someone to come out of retirement without having any experience in the field and then jump right back into it would be under somebody who was actively supervising them. Someone who's been out of the profession for 10 years may have a wealth of knowledge, but they don't have a wealth of skills anymore, or they may never have had a wealth of knowledge. But yeah, they don't have the skills anymore. They're out of practice, and they're charging you a premium for well, I really can't call it competent care because it's probably not. So, I mean, but it's amazing the stories they can spin about how they're your last best hope and they're what you need right now. And it might be very tempting, and you may not want to jump through all the hoops to go to the doctor's office as it is right now. It's really, really worth it to get qualified, competent care.